I would like to present a successful case study in the treatment of string halt in the horse using the elevation piezoelectric shockwave machine. The string halt, which has been appropriately determined to be a hyper reflex of the lateral digital extensor muscle, is due to the inappropriate reflex loop with the Golgi tendon apparatus in the tendon and the hyperactivity of that lateral digital extensor muscle, creating this steps that you will see in the videos that are uncontrollable to the horse. This inappropriate reflex loop is created by many different causes. With our case here, it was an EPM result, but there are very many causes of this inappropriate loop. The unfortunate reality is that the only understood or the common treatment for this up to this point has been surgery to cut the lateral digital extensor muscle. The case I'd like to present today is Casanova, which is an off-the-track thoroughbred, 10 years old. And basically he's in a low-level riding program with the owners and presents with EPM relative to the cardinal signs of weakness, lethargy, muscle loss, muscle wasting. The horse was diagnosed on clinical exam and was treated with Protozil for 30 days. There was no string halt or any type of problems to that effect prior to the EPM. After the EPM, 1 month after the treatment, it was noted that the horse was not being able to be ridden due to his behavior and his inappropriate function to his hind legs. A month after that, essentially several months after the termination of the EPM treatment, I evaluated the horse and found that the EPM was well managed. The horse was physically in a much better way due to the Protozil, but definitely had this abnormal gait, the string halt to this hind leg. Here we see Casanova before the treatment. The lateral digital extensor on this right hind is where the hyperreflection is, and it's seen mostly when he's changing his gait or trying to be more intentional about the use of this leg. So with Casanova's disability, he is unrideable currently. He had been in light lunging work up to this point, and there's been really no change in his posture, demeanor, or his function. So at this point, the condition is static. There is no improvement. So you can either do one, which is surgery to cut this lateral digital extensor tendon, or you can do the singular treatment of the piezoelectric shockwave device to the muscle in the muscle fascia and the tendon itself. The treatment idea is that I am very generous in using the shockwave in the entire area, as opposed to feeling that you need to be exactly precise in the application of the therapy.
Right.
I use light sedation just to keep myself and the machine safe. There really is not any pain to this treatment. The shockwave creates an area of high pressure by focusing the sound waves into an area of high pressure, very similar to what a magnifying glass does to light. This focal area of sound creates an area of high pressure, which leads to expansion of the tissue on a very localized level. The fascial element of this expansion of the tissue is what creates a therapeutic effect. And the elevation device gives you a lot of latitude in regards to putting different offsets onto the unit itself, giving you an ability to focus into a very precise location. And so the idea is that the more focalized that area of high pressure is, the more beneficial effect you'll have. And so with the shockwave, we can fix this in a very natural way by loosening that muscle fascia. So the element of the shockwave therapy is that it resets or allows the body to reset that reflex loop. And that's exactly what happens here in this situation. In this video was taken 1 month after the shockwave therapy. Casanova's gait basically has improved. He is rideable, and there is no evidence of the hyper reflection on this right hind leg. And so the important aspect is that this can both be seen by the fact that he is much more comfortable, much more relaxed in his lunging, as well as the fact that he shows none of the abnormal gait that existed prior to the shockwave therapy. And to this date, which is a year later, there has been no relapse or any other further problems with this horse. He's basically back in full work and everybody's happy.